Alberta is adding new barriers for people who want to access medical assistance in dying, also called MAID. The provincial government says it's adding safeguards to its legislation before the federal government makes changes to the procedure.
For the patient specifically, the bill would make it so only someone whose death is reasonably foreseeable within the next 12 months could access MAID. It explicitly states people whose underlying condition is solely a mental illness cannot access MAID. That's notable because that's not actually legal yet. And finally, this bill would prevent people from making advanced requests for MAID, which Quebec does allow for people who are lucid at the time of that decision. Providers would not be able to bring it up in a conversation with a patient unless the patient brings it up first. Providers would not be allowed to refer someone to MAID options outside of Alberta. And finally, there's actually rules in the bill about where information about MAID can be, including pamphlets and posters. The province says it wants to protect vulnerable people, specifically those living with mental illnesses, from making a very permanent decision that could either be addressed in other ways. So, example, more mental health care, better social services, things like that.
If we allow for children and we allow for those with mental illness to be given the advice to take this this approach, then I think that we're failing in our duty to give people hope. So we have taken a very different approach in Alberta, where we believe recovery is possible, not only for addiction, but also mental illness. And that is why we think that the federal government is going in the wrong direction with its intention to put this in place in 2027.
So I do have to stress that children have never been legally allowed to access MAID in Canada. That is enshrined in the provincial proposed law there.